An APP is short for Advanced Practice Provider.
So APPs are physician assistants as well as nurse practitioners. We are providers that do as much as physicians do, but our schooling route is a little different.
Individuals who have training that allows them to deliver care in conjunction and in collaboration with primary care physician or physicians. In my experience, my APP has worked directly with me, kind of collaborated on the care of my patients, and it's this partnership that has really helped me to really deliver good quality care.
Sometimes there's a misconception that we can't see our own patients, but most of us do, whether we're in a subspecialty or primary care.
Kind of be the physician's collaborative provider, so they can prescribe medications and also make diagnoses as well.
Pretty much the same as what you would do when you go to a physician's office. You'll get your vitals drawn, the provider will come and see you. We'll talk about what you're here for, prescribe medications, order labs, essentially the same thing.
Acute problems, they can also manage chronic unstable or chronic stable conditions as well. So we have a lot of patients who are diabetics, patients who have hypertension, patients who need maybe a wellness visit. They're able to help manage these patients, and they do it well.
Physicians usually go to undergrad, then graduate school, medical school, and then after that they pick a specialty such as primary care or whatever. They decide if they want to do a fellowship or further their studies. Versus PAs, we go to undergraduate, then we go to graduate school to become PAs. Sometimes they're surprised that we're not a physician too, because we have so much knowledge and essentially we do pretty much what physicians do. Our schooling is the main thing that differentiates our scope of practice.
In the primary care practice, typically I have a panel of patients and I usually see them in certain intervals. And what I've been doing is I'd say, Mr. So-and-so, Miss So-and-so, I would like you to see my APP, and they will follow up to make sure that the medicines are working, making sure the treatment plan is well.
If you can't see your physician, you can come and see me, which really helps because I work directly with the physicians in my group versus having to see another provider who doesn't know you, or going to an urgent care or going somewhere else that they don't know you as well.
And so what I find is beneficial is that you have two eyes or two sets of people looking at you. You have the primary care physician who kind of has the overarching picture, but you also have an APP who is also looking at you and also familiar with you as well. Me talking with my APP about my patients, make sure that the patient is getting the best possible care.